For more now on the spread of the virus, we're joined by Dr. Cheryl Holder, an associate professor at FIU and program director of Panther College of Medicine Communities. And Dr. Holder, one of the big headlines today is that Miami-Dade's COVID ICU capacity is at 118%. Sounds very alarming. How is it possible that ICUs are operating above 100% capacity?
Well, it sounds alarming, but the real issue is that we allocate certain amount of beds in a hospital for ICU care. But that doesn't mean that's limited. We can convert other areas and convert other beds to it. It's based on numerical, how many beds you expect in your community. But when a pandemic hits that requires more than what you've allocated, then you go over the percentage, so you're 118%. But for most of the hospitals currently, if we can control this, there still will be capacity to expand their ICU care. So the goal is really to flatten the curve, decrease the infection so we can control this infection.
All right, Doctor, if we could digress for a minute, maybe you can help us dissect these numbers. We've seen what they've been reporting in recent days, that the numbers are really climbing at an alarming rate. And we've heard local leaders say it's mostly because of young people between the ages of 18 and 34. Is that really what you're saying? Is it solely on them, or is there something more happening here?
Well, the age range that's out and about and able to be exposed are going to be younger. We got the message out very clearly to the older people and folks with high-risk diseases that they should stay away and protect themselves. And I think we've done a good job. We've done a better job in controlling with the elderly and some of the nursing homes. However, if you're going out and you don't have proper protection and the messaging isn't quite clear and you feel you can go socialize, and that's when the bars are open and things are open, you do get the comfort that you should be able to go. So yes, that population is most at risk because they're out and about and will be exposed at the levels that will give them the infection.
You mentioned needing the proper protection to go out. Many are saying a mask is what you need, and there are mandates throughout South Florida, but a lot of people are hesitant. They're resistant to actually follow those mask mandates. Now the county mayor is actually putting some enforcement behind them. But what do you say, as someone in the medical field, to people upset by the mask mandates and maybe claiming, oh, it doesn't work? We were told very early on in the pandemic that masks weren't needed. Why are we needing to wear them now? What do you say to them?
Okay, early on when we didn't know as much, there was a mixed message, absolutely. Now it is clear, clear, clear. Plus you don't really need a study to tell you. When you cough, you cover your mouth. So you stop the spread of your secretions coming out. So obviously, if these things are microscopic, really tiny, covering your mouth because it comes out when you speak makes sense. The studies are clear. A mask on both sides protects you and protect the other person. There's no debate that masks work. Face shields work, masks work, and that's what we're going to need. We've seen it done in New Zealand. We've seen it done in other places. The original messaging wasn't clear, but now we have data. It's just like everything else. Things change, and we learn from what happened, and we've learned enough that masks work.
All right, Dr. Holder, thank you so much for clarifying all of this, and we thank you for joining us tonight on CBS 4 News at 7.
Thank you.